Okay. So, as Vanessa introduced me, I'm a psychologist here at the Hearing and Balance Centre, and I work with Jennifer, who is also a psychologist here at the Hearing and Balance Centre, and we do the counselling component of the Tinnitus and Hyperacusis Management Program. And today I'm going to talk to you about managing tinnitus and hyperacusis effectively. First of all, what is tinnitus? So tinnitus is a physical condition. It's experienced as noises or ringing in the ears or head when there's no such external sound. So people experience sounds like cicadas, bells, all sorts of sounds, drilling noises. So it can vary in volume and also the sound. It's a symptom of a faulty hearing system. It's a symptom of a faulty hearing system and not a disease in itself. Hyperacusis is again also a physical condition, and it's experienced as a reduced tolerance to sounds and an oversensitivity to sounds by everyday sounds in the environment. So the person experiences physical discomfort. Some people experience severe pain in their ears when they're exposed to certain sounds, whether that sound is quiet, medium, or loud in volume. An example of hyperacusis, if someone has hyperacusis, an example would be a person who, when they hear the plates clinking, for instance, being put in the dishwasher and they're clinking, that can cause incredible pain for them. Whereas for someone that doesn't have hyperacusis, it doesn't even bother them, they don't even notice it. People can have either tinnitus and hyperacusis together, or some people just have tinnitus on its own without hyperacusis, and others also just have hyperacusis without tinnitus. So it has different presentations. And for some people, tinnitus and hyperacusis can be quite annoying, debilitating for some. Because it impacts on their life, that they aren't able to do things that they once could do, like, you know, working to their to the way they used to before, going out and socialising with others. So it can affect a lot of the things in their life that they once used to enjoy. And as a result of that, they can experience anxiety and depression. So there are different ways to manage tinnitus and hyperacusis. Today I'm going to talk about the therapies that we do here at the Hearing and Balance Centre, but I'm also going to give some general information towards the end as well. And hopefully as I'm going through the therapy and also the different therapies and also the general information, that you'll pick up some points if you're suffering from tinnitus or hyperacusis that you can apply to yourself. And today I'm going to talk about tinnitus retraining therapy and cognitive behavioural therapy. Tinnitus retraining therapy. How many people have actually heard of TRT, tinnitus retraining therapy? Okay, so there's a few. Okay. So tinnitus retraining therapy is probably one of the most popular interventions for tinnitus. It's used internationally. It was developed by Dr. Paul Jasrabov in the mid-80s. And what it does is it provides us with a model that helps explain how tinnitus and hyperacusis is processed by the brain. And in terms of for tinnitus, the aim is for TRT is for the person to habituate to their tinnitus. So in that sense, what habituation means is that they would have a neutral association to their tinnitus, no longer fear it, but just be neutral towards it. And when they're neutral and they don't fear it, their brain doesn't need to keep monitoring it. For hyperacusis, the aim of TRT is actually to desensitise the auditory pathways that are overstimulated, okay, so that the person can tolerate those everyday sounds that they can't tolerate at the moment. Okay, so if we look here at this, I'm going to talk to you about TRT for tinnitus. So in terms of what we understand with tinnitus, what happens is the source of the tinnitus is in the cochlea, and then it's an electrical signal that is then sent to the auditory cortex in the brain, and that's where we hear sound. And for some people that hear tinnitus for the first time, it's a big shock to their system. And what happens is, as a result of that, they can start to feel quite anxious about the tinnitus and see it as a threat. So what then happens is the brain then starts to monitor the tinnitus. So, to give you an example, we liken it to being like a lion. If we liken the tinnitus to being like a lion, if I was to tell you that I was going to put you in a yard with a lion, we all have negative information about lions. We actually, well, I do, that, lions are dangerous and they can potentially eat you and hurt you. So what would happen is, if I put you in the yard with a lion, what would happen is your brain would then monitor, become hypervigilant and monitor the every move of the lion. And that's similar to what happens with tinnitus. So and as a result of the negative information we have, that builds what we call a negative emotional association to it. And we feel quite anxious. And in that situation, our anxiety is actually helping us to survive in that situation. But if I was to remove you from that yard, you would no longer need to monitor the lion because it's no longer a threat. So in relation, if we go back to the tinnitus, what happens is, in terms of the tinnitus, because the tinnitus is in the person's ears or head, it's not as though they can escape it. So the brain's going to try to protect you and monitor that threat. So you then start to become very hypervigilant to tinnitus. So tinnitus retraining therapy involves two parts. The directed counselling part is what Jennifer and I do here at the clinic, so the counselling side of things. And the auditory therapy is what the audiologists do. We also touch on auditory therapy as well. So directed counselling involves us explaining using the TRT model, which is the neurophysiological model, which today I don't have enough time to go through because it's quite detailed. But it's actually going through and explaining to the person about what's happening in terms of the tinnitus and how we understand that the two parts of the brain that maintain the tinnitus signal are the autonomic nervous system and the limbic system. It also we talk about how we can train the brain away from the tinnitus using the TRT model. So the aim of directed counselling is to reverse that negative information that people have received about tinnitus. For those that have tinnitus, who have received negative information about it? Yeah. On the internet, through talking to people? Yeah, okay. So it's a process of understanding the model and reversing that negative information about tinnitus. And when people become more neutral towards the tinnitus, they then can start to accept the tinnitus. And what happens as a result of that, the brain doesn't then need to keep monitoring the tinnitus.
So could I just ask you, monitoring the tinnitus by the brain means noticing it?
Yes, noticing it. Keep being vigilant to it, yes. So if we go back to the lion, the idea would be that, yeah, here we are. The idea, if we go back to the lion, by giving that information and the person becoming more neutral to it, it'd be like a trainer with their lion who they see as a pet, and they understand, and they're not fearful of it. And that's what is the aim with tinnitus, that the tinnitus becomes part of you, but you don't fear it. In terms of auditory therapy, one of the important things you can do is to actually have a hearing test. And all our audiologists here at the Hearing and Balance Centre have experience with people with tinnitus and hyperacusis. So they're mindful of the fact, especially with hyperacusis patients, that they're concerned about their ears. And it's important to have a hearing test because that provides us with information in order to do the TRT, because there's different ways of managing tinnitus depending on if the person has hearing loss or normal hearing, etc. And it also helps us to explain the model. So auditory therapy actually involves using sound appropriately in your environment. So for someone, for instance, that has a hearing test and it comes up they've got a hearing test and they would benefit from a hearing age, then hearing aid would be suggested. Also on top of that, they would use a sound machine which generates like sounds like rain, a constant neutral sound like rain, stream, environmental sounds, but they need to be constant, which I'm going to go into a little bit further. Or an iPod. People these days are using iPods on a dock to create that sound machine experience. For someone that has normal hearing, it might be suggested that they wear white noise generators depending on the degree of their tinnitus, and a sound machine, or again using an iPod to help with that environmental stimulation. One of the important rules of auditory therapy is to avoid silence, especially in the initial phases. Some people that have tinnitus try to avoid any noise because they think that's going to settle their tinnitus down. But if you think about it, if you're in silence, all your brain is going to hear is the tinnitus, and it strengthens that negative dissociation, and it gives you more opportunity to keep focusing on the tinnitus and that threat response occurring. Another important rule of auditory therapy is not to mask the tinnitus. And again, understandably, when people have tinnitus, they want to have a break from it and they want to escape from it. So sometimes what they do is they'll actually try to mask their tinnitus with music or other sounds. I can see some people nodding in the audience. That is actually not good for the tinnitus, because what happens is when we mask tinnitus, your brain's not hearing it. So when we take that mask away, because the brain hasn't heard the tinnitus, it will actually sound louder. Okay, so it's not a good idea to mask the tinnitus. And to habituate to the tinnitus, what we need to do is to be able to hear the sound at a reduced level. If we can just keep questions to the end, that would be really good. I'm happy to answer questions. So what we want to do is, one of the important rules is to use a constant neutral sound with the tinnitus. Constant, so all the time as much as we can, of course. Neutral sound is something that is constant in terms of not only using it as much as we can, but also constant in volume. So like rain, where it's constant, not like waves where it undulates. So we want constant neutral sound. So neutral in the sense that we don't want something that we really like. We just want something that will be on in the background that we don't have an emotional association to. The idea is if we do that, it reduces the tinnitus signal going to the brain, and the brain then has the ability then to retrain away from it. So it changes the way it perceives the tinnitus. So with directive counselling and auditory therapy, what happens is, with time, and this takes time, the person starts to accept their tinnitus and become more neutral towards their tinnitus. And this results in the tinnitus decreasing in loudness. Generally, people find that it decreases in loudness or goes to the background. And also their awareness becomes less with the tinnitus, because there's more important things that they can focus on, because the tinnitus is no longer important to monitor. TRT is not a cure. So if anyone tells you it's a cure and it's going to totally get rid of your tinnitus, that's not correct. But research shows that it does help people 80% of the time from looking at the research. So if we look here, now I'm going to talk about the TRT from the hyperacusis perspective. So this time we have an external sound. So I mentioned before about the plates clinking. So what would happen is that sound of the plates clinking is picked up by the cochlea. And what happens is the auditory part going to the brain is overstimulated. And so instead of just hearing that plate clinking at a normal level, what actually happens is it's really amplified for the person. So they hear it really, really loudly. A lot of people that have hyperacusis understandably start to fear the noise that they hear externally that causes that discomfort and pain. So they start to fear it. And as a result of that, the person starts to avoid situations. So whether that be physically, for instance, some people in terms of the plates clinking would avoid going to the kitchen when the dishwasher is being unloaded or the table's being set. One person that I saw had hyperacusis so badly that they actually used plastic cutlery because they couldn't stand the noise of cutlery on the plate. So again, you can see it happens in different degrees. Also what happens is, people can also start to wear ear protection, like wearing earplugs. So when they go outside, they wear earplugs, or I've had people wear earplugs in the house as well. So, and again, the more you wear ear protection, that can also increase that fear because the more sensitive you become to sound. And also in terms of the model, when we look at phonophobia, it's similar to tinnitus in that the two parts of the brain that are activated in phonophobia are again the autonomic nervous system and the limbic system. So again, that results in that fear loop and that threat response. So with TRT for hyperacusis, it involves directive counselling and again auditory therapy. And again, Jennifer and I do the directive counselling component and audiologists do the auditory therapy. So directive counselling again involves explaining the TRT model, but this time from a hyperacusis perspective and also from the phonophobia perspective for people that have phonophobia. The idea of that is to help reverse that negative counselling that people have. Some people have heard that you really need to protect your ears because you're going to damage them if you go into those sorts of sounds. So it reverses that negative counselling. It also addresses the person's concerns. One of the probably major concerns that a person with hyperacusis has is that they fear being exposed to that noise with plate clinking, that it's going to actually damage their hearing system. But that isn't actually the case. So it's actually addressing those concerns. It also encourages, again, a neutral association to the sounds that cause that discomfort. So trying to get them developed, like with the tinnitus, to get them to develop, not to have a negative emotional response when they hear the plates clinking. And I can see people are saying, well, that's easier said than done. And I'm going to go into more detail about how we can do that. One of the things that when people have phonophobia, they tend to overuse, phonophobia with hyperacusis, they tend to overuse ear protection. And I've touched on this before, that with overusing ear protection, what happens is it's increasing your sensitivity to those sounds, those external sounds. So I'm going to use an analogy here. If you think about it, if I was to give everyone here sunglasses, and I was going to get you to wear those sunglasses for the next 48 hours, and I got you to come back here after 48 hours, and I asked you to take those sunglasses off, what's going to happen?
Very bright.
Yeah, it's going to be very bright. You're going to be oversensitive to the light, even though it's not very, there's not a lot of light in here. You can still be very oversensitive, and that's exactly what happens when you start to overuse ear protection with hyperacusis. You become even more sensitive to those sounds. It's a natural instinct to try to protect your ears, and then we can understand why people do it, but it actually makes you more sensitive. In saying that, you obviously do need to wear ear protection in appropriate places, and I'm sure people have been to Patrice's talk on hearing protection. So there's certain situations that we all should wear hearing protection, so I'm not saying not to do it in those situations. So auditory therapy involves using the appropriate use of sound in the person's environment. Again, the aim of auditory therapy is to desensitise, that oversensitisation of the auditory pathways that I mentioned initially. And how we do that is we get the person again to use that constant neutral sound, but this time at a level that's comfortable for them. So putting rain maybe in the background at home, rain sort of environmental sound, or stream or white noise at a level that's comfortable. Because if you turn it up too high and it's really uncomfortable, then it's just going to keep that phonophobia happening, that fear of noise happening. And what we do is then gradually, that noise, as the person starts to adjust to that, we increase the noise again. And what also happens is we get the person to gradually expose themselves to the sounds that they can't tolerate. So from starting with sounds that are easiest to expose themselves, that's still uncomfortable, but are easiest to more difficult sounds. So for instance, going in the kitchen with the plates clinking would possibly be easier than going to a supermarket where there's a lot of background noise and a lot of trolleys clinking and things like that happening. Okay. Also with auditory therapy, I suppose the idea in terms of desensitization, Jasrabov actually uses the analogy of someone having a very pale, sensitive skin, and they go out and they get sunburnt if they go out into the sun for too long. And the idea would be to get that person to gradually go out each day and slowly build up the time that they're out there, so their skin builds up tolerance to the sun. Well, in terms of hyperacusis, so with the directive counselling and the auditory therapy, the aim is to allow the person to be able to go into those environments and tolerate the sound they once put in. The period of time that it takes to undergo the therapy varies from person to person, because some people, they have not so severe hyperacusis, where others have extreme hyperacusis. But generally what we find here at the clinic is people find that they're no longer sensitive to those sounds that they once were sensitive to. Next thing I want to talk to you about is cognitive behavioural therapy. Just out of interest, how many people have heard of cognitive behavioural therapy? Good. So there's a few people. Great. All right. So the aim of cognitive behavioural therapy in relation to tinnitus and hyperacusis is to, again, help the person deal with that annoyance and distress that they experience when they have a tinnitus, and also when they have the exposure to those environmental sounds in hyperacusis. And for hyperacusis, it also, by becoming more neutral to those sounds, allows them to go out and be able to experience that greater exposure I was talking about before. So cognitive behavioural therapy is based on another model. And basically what it is that when we have an event that occurs, depending on how we think about that event, results in how we feel and behave in that situation. And what we know in cognitive behavioural therapy is that we can change the way we think, and as a result of changing the way we think about things, we can change the way we feel and behave. So I'm going to give you an example of the situation with tinnitus. So, for instance, if a person had negative thinking, they were thinking in terms of their tinnitus, that the situation was that tinnitus had increased, they would think to themselves, my tinnitus is so loud, I can't cope with this. What if it gets louder? It's going to destroy my life. I'm going to go mad with this. I'm not going to be able to go out tonight. And as a result of that, they feel extremely anxious, they feel depressed, and they don't go out because they just feel they can't do that. For cognitive behavioural therapy, the aim would be to change the way the person thinks about their tinnitus and become more rational and constructive in the way they think about the situation. So, same situation, but the person thinks to themselves, my tinnitus is loud at this time, I've coped before, I'm going to do my relaxation as I know this helps lower my tinnitus. I've had episodes of loud tinnitus before and they've got better. I'm going to go out tonight because I know I feel better when I go out. And as a result of that, the person feels calmer, accepting of the tinnitus, and they go out. Now going to an example with hyperacusis, in terms of hyperacusis, if the person, say, at the shopping centre, they're doing their grocery shopping, they may have negative thoughts about the situation. They think, this noise is so loud, I can't do this, it's going to damage my ears and make things worse. I have to get out of here. And as a result of that, they feel extremely anxious, They put earplugs in. In some instances, they may even abandon their trolley full of grocery shoppings and leave the situation just to get away from the noise. But again, with cognitive behavioural therapy, learning the skills to challenge the person's thinking. It appears to be hard, I appreciate that, because people that have tinnitus quite often can have problems sleeping, but to try to learn some strategies to help you sleep, because if you're getting a good night's sleep, then you're not as vulnerable and you're not as stressed, whereas if you're obviously not, you feel more stressed and vulnerable, and the tinnitus and hyperacusis can become quite overwhelming. And also, lastly, reducing stress. For stress can make things like tinnitus and hyperacusis worse, as well as other things in our lives. And to actually learn some ways of doing relaxation, such as Tai Chi, yoga, learning some progressive muscle relaxation and deep relaxation can be helpful in reducing stress. And also, again, cognitive behavioural therapy can be useful to help people reduce stresses, to teach people different ways of thinking about the situations that are causing the stress. So today I've touched on hearing devices, I've talked about tinnitus retraining therapy and also cognitive behavioural therapy. And we do the hearing devices, cognitive behavioural therapy and TRT here. And hopefully I've given you the message that you can do something about tinnitus and hyperacusis. Thank you very much. Questions? Yes?
Yes, I just wanted to ask you earlier on, you spoke about the white noise generator. Yes, earlier on you were speaking about a white noise generator, but then you said do not mask the tinnitus. So I don't understand how the two, in one moment you're saying not to mask it, but the next time you're saying that we should have the white noise. And also to avoid silence, well, when you're trying to get to sleep at night, should you be listening to the white noise? Because you should.
I'll just answer that. So the question was, there were two questions. One was, I talked about white noise, using white noise generators, yet I also said not to mask the tinnitus, and how does that work? In relation to that question, if we mask tinnitus, as we know masking is, that would be to cover it so you cannot hear it. The white noise generator, we don't do that. We put the white noise generator or sound machine at a level below the tinnitus, at a level that's comfortable. It doesn't have to be right below the tinnitus. It can be at a level that's comfortable. So we're not masking it, you still are hearing the tinnitus. So that's the difference between masking and using a constant neutral sound below the tinnitus. Does that answer your question?
Should you have the white noise when you're trying to sleep?
Yeah, look, actually, with tinnitus retraining therapy, we do get people to use...
But does alcohol play any part in it? And like chocolate, it's got baked chocolate and things, and whatever.
Okay. In terms of alcohol, for some people, yes, they experience an increase in tinnitus, especially with red wines, because red wine's got sulphur in it. Sulphur is known to, in some people, aggravate the tinnitus.
Red wine, so
yeah, but in saying that, it depends on the person. For some people, I've had people that can have one glass of red wine and they're fine. Other people have just one and their tinnitus is roaring. So it's very individual. Our system is very individual, and I suppose it's through experimenting with that to see what effect that has, if it does affect your tinnitus or not. Did you have a coffee? Oh, coffee. And how much coffee? Again, in terms of coffee, we don't say get rid of coffee totally, but if you're having 10 or 15 cups of coffee, which I've certainly had people are having 10 or 15 cups of coffee, that's going to stimulate your central nervous system and that autonomic nervous system and increase the tinnitus perception. Although in saying that, for some people, again, are quite sensitive to caffeine, and even just like having one can make the tinnitus worse. So again, it's going through that process of experimenting and seeing how it affects your body.
And what about, say, blood pressure? Most of us probably in this room are on some form of asthma.
Yep. Okay, the aspirin, the aspirin you're on is probably a low dose, and you need, if you've obviously got a medical condition and you've been told to take medication, you should continue to take that, because obviously it would be, you know, not good if you had a heart attack or something. So definitely stay on your medication, but it's only a low dose. So yeah.
I've just got the tinnitus. I've just got that in the last 2 weeks, and I'm already crazy with it. I've went and bought some soothing music and put the earplugs, iPod things in my ear and put it on so I can't hear the ringing. Now, is that wrong?
That's wrong, yeah. I mean, if we're looking at it from a tinnitus retraining perspective, absolutely, because what it's doing is you're avoiding hearing the tinnitus because you're fearing it. And what happens is that, again, when you take that noise away, like when you're in a situation like this or in other situations where it's quiet, you're going to hear it even more, and it's strengthening that negative association to the tinnitus. So yeah, the white noise would be, it's just a constant, like a sound or rain. Okay, so you need to find a shower noise or a stream, running stream. There's a whole lot of different sounds. And certainly if you want to talk to me after this presentation, I'm happy to talk to you about that. But also in saying that, just I was going to say one thing. The fact that you've only got it recently, it would be good for you if it is driving you mad to get on and do something, because we know the earlier intervention, the more positive the outcome, because we break that negative association.
One more quick question.
Maria, I was going to ask whether there was any difference between the type of CBT that you may get any psychologist versus a person at the hearing centre, but I thought of a better question, and that is can you do CBT in the absence of other auditory therapy? Or
without using auditory therapy?
Yeah, does it work for people?
For some people it does, absolutely. And then again, it depends. It's an individual thing. Some people find that, yes, by doing cognitive behavioural therapy without the auditory therapy, it can help them. I suppose the question is, does speeding it, going through the TRT process and understanding, because that's one of the biggest keys that Jasper found, was people not understanding their tinnitus really holds them back, because those negative cognitions still go on.
Thank you.